And continuity needs a little bit of unpicking. It is said that continuity of psychiatrist is helpful to outcomes for people with severe and enduring mental illness. And I think what that tends to mean is that, to the patient at least, that means that they're going to be seeing the same psychiatrist or the same CPN throughout the course of their health and ill health. Now, in the system that we're in, there is considerable discontinuity, and there's a lot of dissatisfaction with handovers between psychiatrists working in one team and psychiatrists working in another. We can all see that there are difficulties for patients, their carers and families and supporters when care coordinators change. It's quite clear that people, particularly with personality disturbance, find those kinds of changes very, very difficult. Often the change is associated with an admission. So I think we have to do a lot better than we're currently doing in terms of understanding continuity and being clear how we're going to provide it. Working in an integrated care model where psychiatrists are increasingly remote from the face-to-face interaction with their patients in favour of giving advice, support and walking alongside GPs, other people in generic multidisciplinary teams, they're also going to experience this problem of discontinuity. So all of the way through our system, we are hearing that GPs, other multi-professional colleagues, physicians, surgeons, patients, carers and families take time to bed into a relationship with their psychiatrist or their mental health support. That time is usually taken up with developing a trust and understanding of the person and the advice that they're going to give. And only after that period of time and trust do they start to work out how we communicate the essence of mental health practice to them. So whatever we decide to do in these future years, it's got to address two principles. The first principle being, how do we extend access and make mental health expertise more accessible? And at the same time, how do we promote continuity in care relationships, but also continuity in coaching relationships?